If it could, every few months Britain would ask the NHS to do something almost impossible: cut waiting lists, move care into communities, and stop relying on agency staff, while many of the people expected to deliver that care cannot afford, not surprisingly, to live near the hospitals they serve. Which should then, ideally, nudge us to reconsider the NHS housing problem as a productivity problem. England's NHS workforce still carried 97,475 vacancies at the end of March 2026, a 6.5% vacancy rate. Nursing accounted for 21,643 gaps. That is lower than a year earlier, but it is still large enough to undermine promises of faster care. While examining the estate, NHS surplus land data published in June recorded 150 declared surplus plots, plus 213 opportunity plots. Together, that is roughly 1,000 acres. Estimated receipts were about £682 million. But preparing disposal would require £1.4 billion of investment. Hit pause and ask, why sell public land for a one-off receipt if the same sites could retain nurses, paramedics, porters, and care workers for decades? The government's capital framework gives the NHS more than £44 billion over 4 years, with health capital rising toward £15 billion by 2029 or 2030. It states explicitly that it also wants neighbourhood care, diagnostics, and less dependence on temporary staffing. London already is signalling a model in making. The Mayor's Key Worker Living Rent scheme aims to start 6,000 rent-controlled homes by 2030, with rents linked to 40% of key worker net household income. The saving could be £4,500 a year on a one-bedroom home and £7,000 on a two-bedroom home. For sure, the national answer cannot be hospital dormitories. However, it could mean mixed-use NHS land, homes, childcare, diagnostics, training and community clinics on the same civic footprint. If every NHS land decision has to pass a health productivity test, can selling, leasing or developing the site end up cutting more vacancies, agency bills and patient delays? Britain should not even be thinking to rebuild its health service while pricing its workforce out of health towns. While many treat the NHS estate as a footnote, it looks like country's most practical worker housing programme.